Now, the Young Nurses Indaba trade union says Health Ombudsman Professor Malegapuru Makgoba is shielding the health department from taking responsibility for the tragic death of Shonisani Lethole. The Ombud found that the care rendered to Lethole at Tembisa Hospital in June of last year was not only substandard but negligent. I'm joined now by Lerato Mthunzi, and Lerato's president of the Young Nurses Indaba Trade Union. Thank you so much for your time today. Now, tell us about the go slow. When did that start, specifically at the Tembisa Hospital?
Maybe let me backtrack you a little bit, Thami. On Nurses Day, which was the 12th of May in 2020, the Minister of Health, Dr. Zwelin Mkhize, came out boldly and uttered words that healthcare workers should not allow to put their lives in danger. In fact, where there is no PPE, they should point blank refuse to work. Flowing directly from this time in May, fast track into June the 23rd, during the period of the 23rd going up to the 27th of June, workers in Tembisa were not provided with PPE by management. But the challenges again with management was that it was at that time very crucial and difficult for the hospital to even get PPE from central office, from the head office. All the PPE to date, as I'm speaking to you, Thami, is controlled by the Gauteng Department of Health. That obviously gives you a picture because we now know about the SIU report and all investigation on allegations of fraud and corruption around the PPE. However, at this time, workers working in casualty, one of their fellow workers had passed on. They were very clear to say, look, we are not going to allow ourselves to contract COVID-19 and even, find ourselves dying. Give us what is due. We want to continue nursing the patients and give us the props. You are asking us to go to war, give us the guns. And unfortunately, that was not there. To a point that on the 26th, the nursing services managers, as well as clinical managers, I'm talking about people that are the executive of the hospital, had to go and work because staff was not working there. Now, it tells you that the department knew. The CEO had already informed the hospital. They had already informed the centrally controlling body for all types of procurement. And unfortunately, at that period, Lethole had died. It's not only Lethole. There are many others on the days that I'm mentioning that lost their lives. And it just gives you a very gloomy picture.
Mr. Mthunzi, you say here in your press release that the CEO of the hospital had sent out communication saying that PPE should not be handed out to casualty nursing staff because there was a shortage. Can you confirm this?
No, absolutely. If you look at a majority of the hospitals, they came to a time where they were saying, this is high-risk areas, this is red, this is orange, this is blue, whatever the colors they were using to zone and say, no, with you, we can only give you a plastic apron and a surgical mask. So that on its own, where you are saying there are areas because you've confirmed COVID, whereas we are also dealing with patients under investigation. And I mean, in a time of a pandemic, we needed to treat every patient as if they were COVID positive until proven otherwise. I also want to take you back, Thami. When the disaster was declared, the minister again came on and said, we are ready. Wainitu said, we are not ready. Our hospitals are in a serious crisis even before the pandemic. How do you come in and mislead the country like this? It's the same issue with the vaccine. You are painting a glorious picture when you know the work on the ground and the situation on the ground is extremely dire.
So what are you saying now? Are you saying that the health ombud was not informed about the reasons why Shonisani as well as other patients at the hospital were not being taken care of?
The ombuds covered the sequence of events as it unfolded. You go to pages 57 up to 60, it actually narrates a full story from first line witnesses, people that had to go in when the stuff was standing out. The ombudsman chooses to ignore that this was a system problem, and this problem had it had nothing to do with an individual. It had nothing to do with a clinician. It was the department at the national level as well as the provincial level that needed to ensure that clinicians are given appropriate PPE for them to be able to go and service members of the community and patients at large.
So are you saying then, Mr. Mthunzi, that despite the fact that there were obviously structural challenges and structural problems regarding PPE that the organization and the hospital should have taken care of, what about the responsibility that nurses have to take care of those who are sick and in need of urgent medical attention? Were there efforts made to try and make sure that perhaps their needs are taken care of? The fact that somebody can stay for 100 hours or so without having eaten anything is quite unbelievable.
Look, Thami, for nurses to have been able to go and do their nursing care, they needed also to protect themselves, and the department needed to give them that protection. For the cleaners to be able to go in and make sure those areas are clean, they needed protective equipment. The people, food services staff that needed to bring that food to the patient and ensure that those patients eat needed to be protected. The very doctors that needed to ensure that this patient gets appropriate medical care had to also be protected. Now, you cannot want to argue and put an ethical argument of saying, no, because you are a nurse, just go in and die. We've lost a lot of good doctors and good nurses in the line of duty, even when they were wearing that substandard PPE. But you can imagine, you're not even giving me the very same surgical mask when I need an N95 mask. So yes, it's just a bad situation. Hence, I'm also bringing in is that I'm glad the death of Mr. Lethole is not in vain. It's highlighting the problems that are so deeply rooted in our department. But at the same time, it is also saying to us, we are failing to care for the carer. We are actually throwing our carers in the deep end, and we are expecting them to swim or sink. And that is unfair to kill healthcare workers who are putting the lives of their families and the lives of their community in danger by even going into those facilities.
Ms. Lerato Mthunzi, thank you so much for narrating your own personal experiences as healthcare workers on the ground at Tembisa Hospital. That's Lerato Mthunzi, their president of the Young Nurses Indaba Trade Union. Certainly a dire situation on all fronts.